Laurence, thank you so much for joining me today and welcome to the Oselo podcast. I can't wait to hear all about you and Accurx. Why don't you start by just giving us an overview of the company?
Yeah, so at Accurx, our vision is that everybody involved in a patient's care can communicate with each other. It sounds really simple, quite uncontroversial, certainly up to this point. No one's told us it's a really terrible idea. But I guess a lot of our experience of healthcare at the moment is that it's not very joined up. And so we want to be this communication platform, this sort of, layer that a lot of healthcare can be delivered on. So anything communication based, whether it's clinician to clinician, or clinician to patient, that's the area we're concentrating in and trying to make that as easy as possible so that a lot of the rest of healthcare, which clinicians are brilliant at, doctors, nurses, reception staff, they can concentrate on the bits that they want to be really, really good at. And we can take away some of the pain where, previously, obviously, there was a lot of letters going around the NHS. Now that's a little bit fewer, but it's still the case. It's very hard sometimes for people to know where their care is up to.
Yeah, okay. So, and you're the co-founder and tech director now?
That's right, yeah. So Jacob and I started the company almost 7.5 years ago now. For the first 6.5, I was at CTO, so Chief Technology Officer, and then I moved into away from the exec team into a more technical role about 9 months ago. So now, I'm tech director of our platform area. So everything to do with our infrastructure team, our platform team, and trying to make sure, I guess, that, we stay up all the time, which is important in healthcare.
Yeah, okay. So what kind of made you stray away from the CTO role, more tech director?
Yes, it was a combination of things for me. It was mainly driven by more personal life circumstances and because I was going through quite a tough time actually last year, I wanted to try and remove a little bit of the stress from my life and still, being CTO and being in the exec team of the company, it was quite hard to try and concentrate on my personal life and run the company at the same time. Yeah. I also, being a programmer, have always been really interested in the actual platform side of things. I'd done a lot of work there initially to grow the platform of Accurx out, and so wanted to just take a bit of a change of pace.
Yeah, okay. No, that makes sense completely. So your background, I know you've got a degree in natural sciences, isn't that right? Yeah. But you were also, like you just said, a programmer. How's your background kind of set you up for where you are now?
Yeah, that's right. So I did natural sciences, but I specialised in physics.
Okay.
So sort of my 3rd and 4th year were exclusively physics. Did a tiny bit of programming during those, but more like, making a little pendulum swing. So really didn't actually do much at all. And then when I came out of university, like a lot of people, didn't know really what I wanted to do afterwards. I had a few friends who had a job in the Science Park in Cambridge, a software company there. And so I thought, that sounds interesting. Happy to apply as well. And was lucky enough to be taken on there, even though, I didn't have loads of programming experience, and spent about sort of 2.5 years there. Doing a lot of software development, very different from what like Accurx has been and what I did now. I was mainly writing software to simulate how oil moves through an oil refinery,
right.
Essentially, and help people sort of who plan the refinery on a day-by-day, hour-by-hour basis do that better. A lot of the existing systems were quite legacy, or even just people using Excel. And then with one of my friends actually who I lived with and worked at the same place, started getting a bit more interested in doing our own thing. And that's probably actually a lot of the skills that more helped me at Accurx, I'd say. So we did some projects in our spare time. We used to help run anyway, a rowing competition at our old university college. It was like an indoor rowing competition. Imagine sort of like 16 rowing machines all connected to one laptop. And it was the software that ran it was quite ropey. And every year we were trying to like creak this old software over the line. And so we're like, okay, we'll rewrite it. How hard can it be? It was very hard. We dragged a rowing machine up from our university boat room up to our study. We played around with it for months, reverse engineering it, writing the new software. And we then sold that back to them for like 500 quid sort of thing. It was like a tiny, tiny amount of revenue, but it was like our first victory. And then once we'd done that, we got interested in a bit of sort of like app development as well. And so I think for me, I'd actually, even though I'd only been doing about 2.5 years of software development, had quite a few different experiences between work, the rowing project, and a bit of app development that set me up relatively well, probably to start Accurx. I think I was in a lucky position where when we started the company, it wasn't really clear necessarily exactly what we needed technologically. And so I think I was probably more of a sort of generalist in terms of programming skills. Right. There were some people who on the entrepreneurship program I was on, who are much more deep technical specialists, had PhDs in machine learning or like things to do with crypto. I think actually having had a small combination of a few different bits probably helped me quite early on in the company to not be too tied to any particular thing and just happy to sort of try and build some sort of solution for what we were trying to solve.
Yeah. Okay. So it was all very university based at first, would you say? Like that's where the kind of interest for you really sparked from?
I think in terms of problem solving and software development, yes. In terms of getting into healthcare, like no, I went on this entrepreneurship program. It's called Entrepreneur First, and it's where I met my co-founder Jacob. When I went on there, I had no idea what problem I was going to work on at all. I'd just come on with my software background. I just wanted to work on something really that had some sort of social impact, that had like a mission. You know, I was looking to start a company. I was thinking I'm going to work at this place for God knows how long, 10 years, 20 years maybe. I want it to be something that I can get up every single day and really, really want to do. So I think for me, it could have been healthcare, but it also could have been things in clean energy, maybe something in politics. There were quite a few interests in front of me. So yeah, certainly in terms of the problem solving aspect, sort of university and the programming bits I'd done up until then, but the healthcare focus was probably more driven actually from a sort of personal values point of view and wanting to do something that meant a lot to me and that was helping people.
Yeah, I think that's really important. You need to have a really strong interest and it really needs to resonate with you in like what you want to do. Otherwise, you lose interest a little bit. And a few episodes ago, we were speaking to Mustafa, who owns MishiPay, and he was saying basically the exact same thing as you. He had about 20 or so failed businesses because his heart wasn't in it.
Yeah.
And so what you're saying there is so right and completely true. You need to have a really strong interest and you need to be able to relate to it. You need to be able to want to get out of bed every day and do it.
Exactly.
Otherwise, what is the point?
Yeah.
So you say you met Jacob on the program. How did were you friends on it? Did you have to join a partner and come up with like almost like a pitch?
Yeah, so Entrepreneur First is a bit of a different sort of talent incubator in a lot of ways. I guess a lot of people might have heard of things like Y Combinator, where people tend to more like have a co-founder, maybe have a business idea that's evolved a little bit before going on and getting funding. There are other ones around like Techstars. Entrepreneur First, yeah, it's different because they invest in you as like an individual, or you go onto the program as an individual anyway. I actually ended up applying with the friend that I'd done a lot of side projects with.
Right.
And so we both went on the program, but very early on, they gently nudged us not to work together because they said, you have very, very similar skill sets. So unless there's sort of a problem you want to solve that needs almost two of the same person, maybe don't work together.
Right.
But yeah, it's basically like co-founder speed dating. That really is the best way of putting it. Like, I mean, when I went on it, which was quite a while ago now, they get all 100 of you in a room. At that point, they were just in London. They were about to launch on other geographies, and they run twice a year for 6 months. So there's 100 of you in a room. Really early on, you sort of go around, everyone stands up, does a 30-second pitch, and pretty quickly they're just like, go, start building companies. And so people start pairing up, they start talking to each other. You get that sort of like school disco panic where you're like, where's my co-founder? And they encourage you to try and, you know, test out different ideas to different people quite early on. They try and make it a very safe environment, I think, to sort of break up with the co-founder and be like, this just isn't working for me, or actually maybe I'm not quite as interested on the idea as I thought I was, or it's already changed since we started. And so I worked with someone else for a week. I then saw that Jacob was still looking for a co-founder, and at that time it was very different. He was interested in trying to tackle antibiotic resistance. So this huge global problem, quite a lot of people know about. Antibiotics are becoming less and less effective through overuse. And he was interested in trying to tackle that and how technology can help try and tackle that. And I thought, wow, that sounds really big, really meaty. I've no idea how we do it, but it sounds cool. And so I said to my co-founder at the time, I'd quite like to go and talk to Jacob about this. And then we sort of met and hit it off relatively quickly. Obviously, you have a few weeks where you're still getting to know each other and trying to sort of build the business. But yeah, we didn't know each other at all before we started Accurx. We were just lucky enough to meet each other sort of a week in and both be interested in the idea. And I guess, yeah, our co-founding relationship sort of seemed like it would work. Obviously, you don't know immediately. But yeah, that's generally speaking how the program works. It's very, very good for anyone who wants to build a business but can't find a co-founder, or doesn't actually necessarily have an idea but think they have great technical skills to bring.
Oh, okay. So do you think that kind of worked a little bit better, the fact that you guys weren't friends beforehand? Because obviously they say sometimes you shouldn't work with your friends because you never know how it will affect the relationship. So with you and Jacob, at first, I'm guessing it was then like strictly business. Do you think that's had a much better impact on the company?
I think for us it's worked. I do, yeah. I know the sort of adage about like you shouldn't work with friends. I can definitely see why. You're going to have some testing times in your co-founding relationship when things aren't going so well, probably. So I can definitely see why people say that. I mean, look, I know some people who it works for. I think some people can make it work. You probably have to have both a very strong friendship, but also an ability to be very, very open with each other and try and keep some parts of the relationship separate. But I think it certainly has worked very, very well for us, being able to sort of form a relationship where, yeah, we're friends, but you know, the main thing that brought us together was the business.
Yeah.
So yeah, all I can say is it's certainly worked well for us.
Yeah. So you actually founded your business in 2016. What
That's right.
year did it go live? What year was the first platform sort of released?
So we actually pivoted as a business back end of 2017 or so. So we worked on that antibiotic idea for about a year and a half.
Okay.
We probably pushed that live in about February 2017 to like the first GP practices. So we were sort of live in under a year. But yeah, through, you know, the first 6 months of it being live in 2017, we just really weren't getting the usage that we wanted. We were, you know, celebrating sometimes like 10 people like using the software a day. And we realized sort of late 2017, this just isn't working really. I think unfortunately for antibiotic resistance, it certainly at that time anyway was, yeah, a huge global problem. But even though we were trying to help make people's decisions better in general practice around whether to prescribe an antibiotic and what antibiotic to prescribe, we were also adding time to the consultation.
Right.
And so I don't think people were probably ever going to really latch onto it because it was making consultations longer. So we took the tough decision to pivot the business. I think October 2017, we had an idea of what we were going to look at, but really what we decided was we just don't know healthcare or general practice well enough at all. And so we spent sort of October, November, December almost living in a GP practice as a team. We were like 7 or 8 people. Every single day, 3 or 4 people would drive to this one GP surgery in Oxford, and we would just try and get under their skin. So we bought headphone splitters so we could listen into reception calls. We observed some consultation. They let us look at some of their accountancy books and like how the practice was being run. We looked at their appointment wait lists, and we did all these different projects and like just soaked up loads of knowledge from the practice. And we were trying to iterate really quickly as well. So sort of as people would be at the practice, they'd be phoning the people back in the office being like, can you get a prototype ready for tomorrow for this? And it was actually when we came back in 2018 that I guess we had 2 major learnings from that time. One, we realized we needed to launch something that was sort of self-serve. With the antibiotic model, we were going to every GP practice, going around each computer, installing, trying to like nip in during coffee breaks and be like, it's set up. And we thought that's never going to scale. You know, we can't get across 7,000 GP practices in the country with that. So it has to be that someone can, more like you would download an app or, you know, go to a website, you go to it, you install, you're done, 5 minutes. And we also realized that sort of everything really we'd observed in the practice came down to communication, often not quite clicking. Like lots of the problems, when we looked at them, we realized actually, if this person could get this person a message way more easily, maybe the problem wouldn't occur.
Yeah.
And that sort of beginning of 2018 was when we decided to launch the first, I guess, part almost of our communication platform. So we launched this really, really simple SMS tool, like embarrassingly simple. It just allowed anybody in the GP practice to send a text message to a patient way more easily. And that was the first sort of incarnation of Accurx as it stands today, basically. So I guess 6 and a bit years ago now. So 5 and a bit years ago now.
Okay, so what exactly were you doing to sort of like build the communications platform? So in between when you decided to pivot and the first launch of the very simple texting platform, what sort of steps did you have to take to kind of, I mean, I know you're saying that you sat in and you really did hard research on the communication styles. What other steps did you have to take in terms of actually building the platform?
So yeah, I'd say it was a couple of different things. I mean, one, like I said, we were trying out quite a lot of different prototypes. So I think we were trying to iterate quite quickly and find out things that maybe did or didn't work. And I think that helped us probably cross off a lot of ideas early on, but also got us in a good habit of like building something, getting something out really, really quickly, testing it with practice staff, and like coming back.
Yeah.
So I think we were learning both a lot of our sort of like user research skills, but just a lot of our build and test skills as well. I think also, yeah, we when we came back in 2018, we then just had to think about like, okay, how, if this is going to operate more as a sort of self-serve model, are we going to, start to do that? Because like I said before, we'd been going to the practice and installing for them. So we had to change quite a few things about the platform to sort of get it ready for that. The actual text message bit, though, we almost already had ready. So as part of the antibiotic software, one of the things we developed was the ability to send a text message to a patient at the end saying, this is why you did, or this is why you didn't get antibiotics. Right. And so we sort of took that and then transferred it over. Okay. And we just made it way more generic. So instead of only within the antibiotics thing, we were like, what if you could text a patient about anything? And what if we just let clinicians actually be in control and they can deliver whatever message they think is most useful? So we were lucky in that some of what we'd already built, we were able to sort of transfer over and didn't have to rebuild from scratch, I guess, everything.
Yeah, that is quite lucky. So how did the funding work for you guys?
Yeah, so our funding story is quite interesting in that we certainly sort of struggled with funding, I'd say quite a lot, like early on. So when we launched the business as the antibiotic business, we got a very small sort of loan note from Entrepreneur First. So through the program, as long as you go through a couple of their sort of funding gates, we have to pitch, you get about 80K in funding.
Right.
And then I think about 6 months almost after the program finished, we managed to close a very small round of an additional about 250K or something. So sort of 330K in total. So really like small amounts in sort of the big world of VC funding. We were lucky enough that we also got an Innovate UK grant.
Oh, okay.
So I'd say for sort of any business that's dealing with the public sector and healthcare, Innovate UK grants are a really great way to try and improve your runway. So for us, that was about an additional 300K. It was paid in arrears, so you sort of spend the money and then they give you a bit of it back. So you have this thing where your bank balance is going down and down each month and then feels a bit better. But it was a great way to extend our funding in a world where in healthcare things do take a bit longer, right? Some of our other companies that are on our cohort who are in fintech or able to release consumer-facing products, etc., might have been able to get their products out a bit quicker than us. And so in healthcare, having that ability to access grant funding, I think is quite useful. So yeah, we only really had those two for the first couple of years of the business. And then we had this slightly funny scenario in 2018 where the business was growing really, really quickly with the SMS tool. At one point, we were growing sort of 20% week on week. So really sort of exponential curve. We suddenly had this feeling of like, we've done a thing. But yeah, the cash in the bank was going down, right? And I remember Jacob and I met Matt Clifford, who founded Entrepreneur First at a coffee shop in London. And I remember him just saying like, just focus on keeping growing this thing and you will manage to get some funding at the end of the year. Like it will come good. And so we were like, okay, Matt, we believe you. And so we focused a lot during that year then on just continue, grow, add, 20, 30 practices a week. And it was going really, really well. And then we were lucky that, at the end of the year, just as things were starting to look a bit tight in the bank balance, we managed to raise a Series A of about 8.8 million. Mainly led by Tomago. So it was completely transformational for the business. Quite sort of scary at the time.
Yeah.
But yeah, completely sort of changed Accurx's fortunes and turned us from, really this small team making this SMS tool into the business we are today.
Yeah. What did that Series A necessarily mean for you guys? Obviously, it meant that you could develop the product even more.
Yeah.
But did that mean that you had the room to test out newer features?
Yes, I think it probably meant a couple of things. Like you said, ability to develop the product more, which ultimately meant really like ability to hire some more people so that we could start to actually build out new parts of the product and maintain some of the existing ones, and also take some bets, I guess, as a business, right? You never know exactly what's going to land. We could actually move to a nice office. We were in this slightly leaky office in Camden. So we could start to actually do some of those things like a bit more properly. But yeah, it also probably meant we could focus still on product development and growth rather than having to commercialize quite so early. So I guess, if we'd raised a slightly smaller amount or not been able to raise at all, we'd have had to commercialize quite early. And I think for us, it meant that we could continue focusing on the user's problems and building out more parts of our communication suite rather than starting to get bogged down in contracts and building out a sales team and all of those things, which obviously we did get to at some point. But, for us, the SMS tool was a tiny fraction of what we wanted to do. It's still, even today, we've done a tiny fraction of what we wanted to do. And so I think for us, it was really important that we could focus on that side of things and not anything else early on.
Yeah. And now you're going through, you've got Series B, haven't you?
Yeah,
you've got
that's
that
right.
Couple of years ago in 2021?
Yeah, so it was almost exactly 2 years ago. Yeah, we raised 27.5 million.
Yeah. So are you going to be looking into Series C anytime soon or not just yet?
So at the moment, not just yet. There's still more we want to prove out with our Series B. We are in a lucky position where we did commercialize the business and that went well in early 2021 as well. So at the moment, we've got good runway as a business, which in particular in this market at the moment is important. For us, the really big thing at the moment is trying to break out of being a primarily GP-focused tool. So we're starting to make some great inroads there. But like I said earlier, our goal is that everybody involved in a patient's care can communicate with each other. And so, if we're just in general practice, that's actually a really small percentage of communications that are going on. In this country, within staff in the NHS, general practice accounts for about 10%. And so for us, we feel like actually there's about 90% of activity still to go, not to mention sort of even other geographies. So for us, before, we go on to raise another round, we really want to crack getting into secondary care. Doesn't mean necessarily being everywhere there, but I guess making the first inroads and showing a bit like we did with GP practices that we have a repeatable model. We know what problems hospital trusts want to solve, and we have a good idea of how Accurx can actually try and help solve some of those. So things like long waiting lists, for example.
Yeah, of course. So I know you mentioned earlier that you had to step down from CTO because you were going through a few personal struggles. What would you say has been the biggest business struggle or personal about being necessarily a co-founder?
Yeah, good question. I mean, certainly one of the biggest struggles we had was just generally running the business during COVID. And I think one of the particular struggles we had was that we were still quite a small team at the time, but Accurx suddenly grew way past what we were imagining already for. When COVID hit, we were in about 50% of GP practices. So we had, a large market share. But within 6 weeks, we were in 98% of GP practices.
That's a very big increase.
Yeah. And we were still a team of about 35 at the time. And then later on that year, we also got involved in the vaccine program and helping GP surgeries book people in. And again, we were still quite small. And really quickly, we were doing, hundreds of thousands, if not millions of vaccine bookings every week. And I think one of the hardest things there was that the team were incredibly stretched. And so I, felt very, very bad for how stressed and how burnt out some people were getting. But we also had this great responsibility to our users, and they were also very, very burnt out and stressed, probably way more than us. And I think that was a very, very tough time as a founder of the business, because for me anyway, it definitely weighed on me very heavily, the sort of pressure that we'd put the team under to deliver. And it was very hard to take our foot off the gas at that point. It wasn't, I guess, an arbitrary deadline that we'd put in place saying we need to release, Accurx 4.0, and at some point you can be like, actually, let's delay a month.
Yeah.
A lot of the changes that we needed to make in the product had to be done. So, as an example, they rightly changed the vaccine timings around Christmas 2020, I think it was. So, originally it was supposed to be 3 or 4 weeks between the vaccines, and they made it 12 weeks. So that got announced live on national television. I think it was on the 30th of December. So most people were on holiday at that time. And we had to pull the team back, try and cancel everyone who had an appointment in January and say, we're sorry, but it's changed to 12 week, and update the software so that it would be after 12 weeks that you book the second dose.
Yeah.
And things like that were obviously just, certainly quite hard for the team. And it lasted, I think, a lot longer than probably all of us imagined, right? The sort of intense vaccine period was all the way from December through to maybe even sort of April 2021. So it was a really sustained time of pressure for the team. And I think, that was definitely hard for us as a business because, you felt the team's stress, but also was working a lot myself as a co-founder, and I found that certainly quite tough.
Yeah. How did you, what was the key thing for you to keep a positive mindset and to stay really goal focused during them tough times?
I think it's the people you work with, like 100%. I mean, everyone was stressed, but they were also like the best people in the world to be with. When you put in place all the hiring processes in the world that you can to try and make sure you hire brilliant people, but that was a real, everyone's backs are against the wall, and you sort of look around and you hope that when you look around, you see some brilliant people alongside you. And we just couldn't have had better people. And I mean the entire team, from people who are actually working on the product through to our support staff, our commercial staff, obviously all the internal people that keep Accurx actually functioning day to day, the talent team who are trying to bring more people in, it was amazing to see everyone pull together. And I think that just keeps you so positive, and you also feel a real sense of like, wow, like look at what everyone else is managing to achieve, and it sort of ups the bar, and so you really think, wow, I want to also make sure that I'm doing my bit. So without a doubt, it was my colleagues around me that like kept me motivated during that time.
Is there anything necessarily behind the scenes that you do like for yourself rather than or constantly like relying on the people around you?
I definitely relied on the people around me at the time. My friends, my girlfriend, obviously quite a lot of the other senior leaders at Accurx, Jacob, my co-founder, and Ben, who's our VP engineering at the time. I also tried to do at least a couple of things a week that would sort of still keep me being me, whether it's, doing at that time, because it was COVID, a sort of gym session in the study, or having pizza on a Friday night with my partner. Just a couple of things to still, I guess, take yourself like away a little bit. But, obviously it was a difficult time for everyone.
Yeah, it really was. So throughout this entire process, obviously, I know you've had Jacob. Did you have any mentors as well? Anyone like when you were maybe struggling, not knowing what to do, like together? Was there anyone that you could necessarily turn to?
Yeah, we've had quite a few people, over the years. Obviously, we have people on our board. I mentioned before Matt Clifford, who runs Entrepreneur First. And we've also got on our board Arena from Atomico and Ollie from Lakestar, obviously investors who have been really great. Jacob and I have also had quite a few coaches over the years, and we've had those both individually at times and also group coaching, which I think's really effective if you're, co-founding a business, that you get to talk to your co-founder quite openly, but sometimes with a mediator, it can really help as well. But also, I think, like I said, some of the other people we've brought into the business who, often some of them will have more experience than you do have been great mentors to us as well, because some of them have been through actually seeing quite a few more cycles than you have. So we've had amazing support over the years from a number of different people, really, as well as obviously friends, family, anyone who's willing to lend an ear sometimes if you need to vent about something.
So you and Jacob, obviously you met on your program. How do you find working together? Do you have different management styles?
I think we've been lucky that we've always found working together quite easy. I think we do have slightly different styles, but for us it's sort of worked in that we always say we sort of have enough overlap that we work well together, but we also have not enough overlap that we bring slightly different things to the table. And I think, we generally, see eye to eye on a lot of things. We've got a good degree of overlap on some of our personal values, but I think Jacob, he's much more on the product side of things, very, very creative, thinking a lot about what the vision of Accurx is going to be in the future. And, I always brought more of that operational, like, do it element, and obviously the programming skills and things early on. So I think we've been quite yin and yang and worked really well together over the years.
Yeah. So did management kind of come naturally to you?
I found it hard. I don't think I would say it came completely naturally to me. Yeah, I would hope that, the reports I've had over the years would say that I'm at least average, if not better than the average. But it's definitely something I've had to work at really hard. I sort of knew early on it was something I wanted to work at hard and have tried to. I think I particularly, especially starting the company quite young, needed to work on some of my emotional intelligence and some of my empathy, trying to stop necessarily approaching one-to-ones from always sort of like a problem-solving aspect. And okay, you've told me this thing, how do we necessarily solve it? And try and get better at sometimes being in listening mode, trying to understand what the person's like actually sort of telling you. Probably trying to get a bit better at actually building a real relationship with my reports and understanding, certainly over the years, how important trust is in some of your relationships. And, actually a lot of those initial one-to-ones when you first start managing someone, it's more going to be about trying to lay the groundwork of the relationship. And I guess I've tried over time to start to open myself up to my reports and sort of say, hey, look, I'm very happy to be vulnerable in front of you. I'm happy to tell you about some of my failures and my mistakes. It's really important to me that this management style works for you as well. And so I guess, like a lot of people say, trying to flex a little bit depending on style. Some people are obviously going to bring tons of notes to one-to-ones. Some people aren't going to bring so many, if any at all. Some people like being in a meeting room. Some people like going for a walk. And so trying to build up over the years some of those ways to sort of flex how you do things. But it's still something that I definitely want to keep working on. I think I found probably one of the most useful things was as we grew the company and had more managers, also starting to have some of those conversations with other people about what's worked for them, their management styles, maybe a tough problem they're sort of looking at. And a lot of that peer learning is probably where you get a lot of the sort of reflections coming out that help you be better.
Yeah. Are you in charge of building the engineering team or the product team? Is that kind of your role to oversee the recruitment of it?
So not anymore, I guess. Yeah, when I was CTO, it would have been I was sort of ultimately in charge of growing that team out. Obviously, that changed a lot how it looked over the years. So sort of early on, and especially I remember during COVID, because we were working a lot on the product, but also trying to recruit. Yeah, did a lot of the early recruitment myself. So I think, we only hired our first internal recruitment person. She was talent lead at the time then, Louise. She's head of talent now. I think we hired a sort of back end of 2019 maybe. We had no engineering managers when like COVID hit. So yeah, all the recruitment was basically Ben, myself, and Louise sort of like early on. But yeah, as we grew out the team, that's changed quite a lot. So, at this stage, we now have it so that we've got a large internal talent team, probably 10, 15 people. We've got an engineering management team of about 10 people as well. And so a lot of the early stages of the interview process our EMs and talent team lead on. And then later in the interview process, when we're sort of reviewing take-home tests or doing the more technical parts of the interview, our engineering team get involved in. So yeah, it's now sort of at the stage where myself, Ben, and some of the other earlier people are a bit more removed, but did a lot of the early sort of hiring of the team.
Yeah. How did you find scaling the team without an internal recruitment person?
Yeah, it was definitely hard. I mean, Louise joining was obviously quite a game changer for us. Like a lot of other companies, we've used lots of recruiters over the years. And tried to sort of partner with a few people as well, but it's always going to be really hard because you're really small and no one knows you early on, and we had the slight disadvantage because we weren't consumer tech in any way. Most people wouldn't be hearing about Accurx through using us, right? Like we're not a bank you would start using and think they're cool, I'm going to apply. Most people just got an Accurx text message and they probably didn't know it was us delivering it. So it was definitely hard early on. And I think for most startups, the hard bit is that classic balance, right? Of you're really sort of like under the cosh and you really need to hire some brilliant people. And so you've got all this pressure telling you to hire. And on the other side, you know, you need to make sure you hire brilliant people.
Yeah.
And so I think trying to sort of withstand that pressure a bit and then wait for the right candidates to come along is probably the hardest part of it. And I think when I say right candidates, I don't also just mean right technically, but also right culturally as well, right?
Yeah.
You want to make sure that both for the candidate and for the business that it's the right place for them to join and that, you know, they're going to enjoy working there. So I think that was the bit I found most challenging sort of early on, was not sometimes trying to buckle under that pressure and you maybe say yes to a candidate that should have been a no.
Yeah, like culture fit is extremely important, and I think a lot of people, especially like you say your company was growing so fast you just needed to hire. A lot of people might just overlook culture fit because they think no, they need people who can do the job, but then in the long run you need people who agree with your values, who love the company just as much as you do, and that's really important for a hire.
Exactly. And I think it's important both for the company but also for the candidate, because if their personal values don't align with the company, they're also going to get frustrated because some of the way maybe you build product or some of the way you make decisions or some of the way you give feedback, maybe it doesn't work for them. And it doesn't mean that they're not necessarily a brilliant candidate or a brilliant engineer. It just might mean they don't work at your company. And so I think it's something that, yeah, is very, very important to get right when hiring, especially early on.
Yeah. So you're saying at the moment you are 98% of the GP market?
Yeah, I think it's still roughly around that. Yeah. It sort of fluctuates a little bit, and there are also GP surgeries quite often closing or merging. But yeah, roughly somewhere between 96% and 98% of GP practices in England use Accurx on a daily basis.
So how does it work with you almost pitching the different trusts for them to use your platform?
Yeah, so at the moment we've been trying to find partner trusts who we can work with really, really closely. And I think we learn from those early Accurx days that it's really important to get to know your users really, really well and understand what are some of the problems for them. And trusts are completely different from GP practices, right? Obviously, a lot more staff, the patients are a lot more acute. They have like whole structures of boards and decision makers, where GP practices can be a bit different. I mean, some GP practices can be quite small and have one or two partners. So very important for us to actually learn a bit about how they work. There are many different services, even within a trust. So, you know, maybe the way dermatology operates is very different to how cardiology operates. So that's, broadly speaking, what we've tried to do is start finding some trusts who are willing to work closely with Accurx and work out, you know, maybe which parts of our existing product suite can help them solve problems, and I guess which parts are missing or which parts of our product suite haven't we built yet that could help them. We've done that, I think, successfully with UHL, so University Hospital Leicester. And we are now live in sort of 10 services across that trust. And we've helped bring down their waiting list by, I think, about 10 or 15% over the last few months. So that's been a really great relationship for us. And I think we probably still need to do that a few more times so that we can actually start to see some patterns emerge across some of the trusts. I think for us, it's still too early to say, like, this is the exact thing that, you know, every single trust necessarily wants. But I think, yeah, that user research element is really key, and them also building up trust in the people and the platform.
So what big tech developments have you seen that you can integrate into your platform? Because I know AI is a massive one. Have you got any AI features currently or planning on adding them in?
So we haven't got too much AI in the Accurx platform. I think the most we've sort of got towards it is we're starting to look at some automatic translation APIs, which Microsoft offer. But I guess two things on probably AI in healthcare. One, obviously, because it's healthcare, you have to be quite careful about it. So yeah, maybe in other spaces, it's a bit easier, but certainly because of what we're dealing with here in terms of, you know, if the meaning of a message gets slightly wrong to a patient or anything like that, we need to be quite careful. Even things like if we automatically marked messages as urgent, you still need to think through a lot of the risks of what if a message was urgent and it didn't mark it, and who holds the clinical risk there. But also, we've been very focused often as a company on trying to solve some of the old needs that I'd say like healthcare still has. And, you know, as much as a few years ago, people were still faxing things around in the NHS. And I think if you go and talk to a lot of staff on the front line, not that many of them will be demanding AI, but actually saying, I'd like, my computer to run a bit faster, or I'd prefer not to have 20 logins for all the different hospital systems I have, or some of those hospital systems to talk to each other so that the blood test from here goes into the medical record. And I guess for us, we've not wanted to get sometimes a bit distracted by it and then forget about what are some of the really core needs that users still have, which is easy to forget about because they've been solved in loads of other places.
Yeah.
And so, yeah, for us, I guess we try and keep a sort of eye on what's going on with things like artificial intelligence, but also try not to forget about, some of those really, really core user needs. I do think on probably some of the sort of actually DevOps and platform side of things, some of the technological developments over the last 5 to 10 years have been incredibly beneficial. So luckily, there was an NHS digital mandate many years ago that cloud-based computing is totally fine. We use lots of modern tools like Kubernetes and lots of other things in our. We use Microsoft Azure in our sort of like platform stack, whether it's SQL servers, key vaults for our secrets, sort of Azure AD, so lots of passwords aren't there. We use lots of things that are really, really modern and have helped us build the platform and the product much, much faster than, say, 20 years ago, where if you were building Accurx 20 years ago, you would have had to build on premises, probably using like old server racks, and be connected to the NHS's sort of private internet, which is called the Health and Social Care Network. So I'd say a lot of those technological developments have really, really helped us build quickly.
Yeah. Is security a big area for you guys? Because obviously you're dealing with patients, healthcare, plans and everything like that.
Yep.
How do you manage and make sure that the security is what it needs to be?
Yeah, it's absolutely a huge part of what we do. It's something we've tried to instill sort of culturally very early on, and especially trying to culturally have, a place of work where people don't feel afraid to ask questions. I think one of the biggest parts of security is, like, ultimately a lot of the time it comes down to humans, and if people don't feel safe saying there's been a mistake, or they feel like maybe they're going to be like punished in some way or it affect their performance, because people do, right, they get like scared about it, think, oh no, I shouldn't have done that.
Yeah.
And obviously the best thing to do is raise it. So that's been one big area, but we've also grown out a fantastic security team. So we've got our Chief Information Security Officer, Diane, who's amazing. We've got a bunch of people on sort of information risk, a bunch of security engineers as well. And so, yeah, it's something we take very, very seriously at Accurx. We try and, make sure, obviously, our product engineers who are actually writing the code understand enough to make sure that they can try and head things off really, really early. But yeah, it's clearly something we need to take very seriously. And I think also trying to talk about it in a way that our users maybe can understand. I think security can sometimes come across as something that's very obtuse, or it's a bit hard for people to understand. So yeah, we try and put quite a bit of effort into, the way we talk about it, or things like your privacy policy, the way you discuss things on your website. All of those things can try and make your platform better. So yeah, it's something we take very, very seriously on both the clinician and the patient end.
Yeah. So the promotion and marketing, is that a big area for you guys? Because obviously you mainly do B2B.
Mm-hmm.
So how do you kind of get your name out there?
Yeah, it's something we didn't have to do in lots of ways, very luckily, early on with the GP practices that used us. A lot of that grew quite organically. But it's something we've had to do a lot more when we started to try and go into trusts. Partly we had an image that was very GP focused. So a lot of hospital trusts either didn't know about us, or they knew of us as this primary care focused tool. But also, as I said, hospital trusts are very, very different sort of like entities as well. So yeah, probably less so in the first few years of Accurx's life, but it's something that we're trying to engage in a lot more now, and trying to make sure that when we, I guess, have discussions with hospitals, yeah, it's great if they already have heard of you, they maybe know your name. Ideally, they've heard about some of our case studies or the great work we've done with UHL. So yes, something now that we've been putting a lot more focus on. Obviously, also just something it's hard to engage in early on as a company, because brand and marketing can be quite expensive.
Yeah.
And so, yeah, also we're in the great position now where we can actually start to focus on those efforts, obviously, while still trying to say which are the things that we think will be, most effective here.
Yeah. So we've spoken a lot about wanting to grow the business and basically where the future lies. But what is something you would like to see for the company in the next, say, 2 years?
I think in the next 2 years, the couple of things I'd probably really like to see are one, so we have a part of the product that helps clinicians communicate with other clinicians. So broadly speaking, it started as a way for clinicians in primary care to talk to their secondary care colleagues a lot more easily. And I just think it could be and is such a powerful product, and it's being used already by quite a lot of the country, so about 2,200 GP practices. But I still just think the potential for it is so large, and we've not even close to unlocked everything that it can do. It's called Accurx, the part of the product suite. So I'd love to see over the next 2 years that just continue to grow on both the GP side, but also on the secondary care side, because we can actually allow them to do an amazing thing where they can contact someone's GP without even needing to know who the GP is, because we can look it up for them. I think also whilst we have interacted a lot with patients over the years, a lot of it has been quite sort of one-off and delivery focused. So, you get a text, it invites you to do a survey, you do it, you're done. And over the last few months, we've started to build out much more of a patient portal, where if you use your NHS login, the patient can see all communications they've been sent over the years, but also from every single healthcare provider. So this is sort of like your unified communication portal as a patient. And I think the potential for that is really, really large, particularly because patients often find that it's quite hard keeping all the different comms together, because the hospital sent a letter, the GP sent a text, maybe the physio sent an email. And so if we can start to make patients' lives a bit easier there, so you've got your sort of one-stop shop of all the healthcare information you need, I think that could be quite transformative.
Yeah, I think it really would be. So you have shared a lot of information about starting a business, struggles, and growing your company. What advice would you give to current founders?
Maybe it differs a bit depending on the sort of size. I think starting out, it might not surprise you that my number one bit of advice would be to go and talk to your users and do sort of as much high quality user research as possible. So, yes, obviously video calls, talking to them, showing them prototypes is good, but nothing beats actually going into their current work environment, and ideally even just being a fly on the wall and just seeing actually what goes on, because certainly from my point of view, that's where we learn by far the most, because you got to actually see what someone's day is like, and it's completely unfiltered. So I think starting out, that would be one of my biggest bits of advice. I think, for people who are sort of more on the journey of growing their business, probably the two things would be to really, really look after your people and think quite deliberately about, how you treat them and the culture of the business that you want to build. And I think the other one would be to try and ruthlessly prioritize. It's something that is really, really hard. Accurx is definitely guilty of not doing it well enough, but focus is probably one of the number one or lack of focus anyway. It's probably one of the number one things that ends up killing companies, because you try and do too many things at once, or you try and spread yourself too thin because you think 5 bets are better than 2. But sometimes actually picking the 2 that you think are going to succeed the most and pushing them the furthest is probably the way that's actually going to sort of unlock the next discovery or the next bit of your product. So I think that's something that is really hard to ask yourself as a founder, because maybe something's going quite well and it's really hard to say, we're going to stop it. We're going to stop people working on it. But I think that's one of the biggest things you have to often do as a company.
Yeah, I think that's really good advice. So I asked a few people for some Q&A questions. I feel like you have kind of answered a few, but I'll still read them out anyway. So what was the timeline from the very start to sign in your first client?
Yeah, that's interesting, because I guess for us, signing your first client is a bit of an interesting question, because we had a very different journey in terms of product and sort of commercials. But I guess we actually got the first GP practice to start using the antibiotic software very early on. So yeah, started the business April 2016, managed to get someone to start using the antibiotic software February 2017. So sort of first person properly using something was about 8 months. I guess that's maybe quite traditional in healthcare, because there was accreditations and integrations we needed. From actually starting the business through to, I guess, first proper revenue probably coming in, I think is going to be about 5 years. So yeah, quite different journey there.
What were the steps you took for your research in terms of building that application and knowing what to include to make it useful to the GPs and patients? I know you've already spoken a lot about that, but are there any steps that you missed, or how did you even manage to get into the GP surgeries?
So yeah, we were lucky that the one that we did the intensive user research at had already worked with us on some of the antibiotic products. I think actually, people have this idea that tech in healthcare is so backwards, and they're so to adopt technology. Some of those things are true, but it's not to do with the people in healthcare. Actually, people in healthcare are really open to technology often and want to innovate, and obviously they want their lives made easier. Yeah. So I think often if you do go to GP practices or some hospital teams and talk to them about something you're building, they will actually be quite open about it. And I think that's actually something that probably applies across lots of startups and lots of industries, that don't be afraid of just going and talking to some people and going and talking to users. And yeah, obviously some might not be either receptive, or some will just be too busy, but there will normally be someone who is willing to do a little project with you, or maybe let you actually observe them for a week or something like that. So yeah, don't be afraid to sort of ask. I think in terms of some of those user research parts, I guess one of the important parts, maybe I touched on last, was as well as that being in the practice every day, I think it is really, really important that you have some time to try and reflect, condense afterwards. And so we would generally, every day when we drove back from Oxford, the people who had gone that day, someone would get out their laptop, and then on the drive you would just constantly discuss everything you saw and try and sort of condense it, bullet point it, be like, is that different to that? Is that the same? So you need some of that compacting type as well. And it also means that members of the team start sort of, being on the same page and sharing some of those insights and building almost like a collective intuition, I would say. So yes, do the intensive user research, but also make sure you share it with your colleagues and have some way of post-it noting, using a Miro board, of condensing it down to what are our major learnings here.
Yeah. Okay. And then lastly, what was your product testing process to ensure the platform was easy to use for people for all ages and all tech abilities like?
Yeah, so that's an interesting one. I mean, the NHS has a very, very diverse workforce. Most people possibly already know that in terms of, age, gender, ethnicity, etc. So I think we were lucky in that most of the time, so long as you went to quite a few different GP surgeries in maybe different areas, you got a good sort of group of users who covered quite a few different points to test it on. But yeah, most of the time it would be that we would develop the product and obviously have some idea about where it should land, and then we would try and again repeat the same thing of going to the GP practices and just observing them using the product and seeing what was difficult about it. Obviously, another really good thing to do is to go and talk to people who aren't using the product, because certainly, initially with Accurx, there would be particularly innovative practices who wanted to pick it up, or there would be particular people within a practice who picked it up, but there was, always a good chunk of people who weren't. And so actually, yes, it's good to spend time with your champion users, but you also want to talk to the people that haven't picked it up and understand why. And often it might be because, the setup's too long, or they find it a bit too complicated. Quite a lot of the time people are worried, especially because it's healthcare, of, I didn't know if I pressed this button, was that the moment it was going to send the text, or was it later because I hadn't finished? And so also some of it's trying to make the design intuitive, and every time you do a thing, you know what's actually going to happen. So yeah, I'd encourage people to go and also talk to people who aren't using a product as well.
Yeah. No, I think everything you just said is really good advice. And the platform, the company sounds like it's doing incredible. And I wish you all the best with
Thank you.
everything and the future.
Thank you so much. And yeah, thanks for having me on.